And we're still at the heart of the big healthcare debate in Washington, where the House has passed a very bad bill that's very unpopular, and the Senate is considering what it's going to do. And the reason we're in front of Assurant Health, quite frankly, is because they're a perfect narrative for what could happen again in the United States if we return to the bad old days. And in fact, it's a two-stage story, as a matter of fact. Assurant actually was one of the companies that did a lot of heavy underwriting and therefore discriminating against people with pre-existing conditions, that narrow plans that excluded a lot of health benefits. And so that was all outlawed by the Affordable Care Act. And we could return to those days. But then Assurant went into the marketplace, which was the right thing to do, and they got, unfortunately for them, a larger number of sick people in their health plans, and the Republican sabotage in Congress that undercut the risk corridors when they cut off the money to companies that had a higher than average number of people who were sick, and that damaged them tremendously, so they spun off their health insurance division altogether. It was highly unprofitable. So it's sort of a story about, and we lost a whole bunch of jobs in Milwaukee. So it's a story both about the bad old system we had and how the current system is stressed by efforts by conservatives to sabotage the whole healthcare system. Now what's at risk right now is that the House plan would allow companies, states to opt out and file for waivers to allow pre-existing condition discrimination again, to not include all essential health benefits, which is insurance companies actually covering everything that one would need. And so we're at risk in this state, especially since our governor indicated an interest in applying for one of these waivers, if it ever became law, of going back to those days and actually destabilizing the entire individual health insurance market, which is what the CBO, the Congressional Budget Office, said would happen potentially in states that applied for these waivers. And so we don't actually have to wait to see what the Senate will do in terms of pre-existing condition discrimination, lifetime and annual limits, essential health benefits, and free preventive care, because the state of Wisconsin could actually go and protect all of those in state law. So whatever Congress does, we would be okay. And so fortunately, Senator John Erpenbach and Representative Daniel Riemer, who is here with us, actually introduced such a bill. And so now all legislators and the governor have the opportunity to either come out in favor, right, of making sure that people with pre-existing conditions can't be charged more, can't be denied coverage because they had a pre-existing condition, or not to be for it. We hope they're for it, but it creates accountability and will make them take a stand as well. We're trying to put a great deal of pressure on the U.S. Senate to take a stand. And actually, we really need to communicate with Senator Ron Johnson, who is actually in the group of 12 that are negotiating the Senate health plan. And so Senator Johnson did the right thing in Washington, but in the meantime, we ought to protect Wisconsinites and state law. So Representative Riemer is going to explain what's in the Erpenbach-Riemer reform package.
All right, thank you, Robert. And thanks to Citizen Action. Thanks to all the citizens out here who are taking action. We much appreciate it. Folks like me who are in the State House and who represent tens of thousands of folks who can't be here because they're working or they're doing something else. Thank you for being out here to get their back and to get the back of people who need health insurance protections. As Robert said, recently Republicans in Congress passed a really terrible bill that would do at least three main things that have gotten the most attention. It would raise health insurance costs for many people. It would reduce coverage for people, 23 million people to be exact, all in the name of a tax break for the super wealthy. But one of the things that didn't get as much attention is this opt-out, that states individually could opt out of various things, including protections for people with pre-existing conditions. They could opt out of covering people with covering people's essential health benefits, and they could avoid preventive no-cost service as a part of the plans. And so that was why Senator Erpenbach and I, in consultation and after many conversations with many of the people that we represent, many people all over the state of Wisconsin, thought it was absolutely essential that no matter what happens in Congress, no matter what happens in Washington, D.C., no matter what President Trump does, the state of Wisconsin has protections in place to make sure that people in the state of Wisconsin can get access to insurance even if they have a pre-existing condition like a heart disease, like cancer, like diabetes, like any of the things that life throws your way. I mean, usually we do an exercise where we say raise your hand if you know someone who, but I would challenge you to raise your hand if you don't know somebody who has a pre-existing condition. I can think of my family, people I work with, whether it's big or small. Life throws things at you. Life, whether you're 6 days old or 60 years old, you can get pre-existing conditions that in the past prevented you from getting access to affordable health care or made you pay ridiculously high premiums. So we're here in front of a health insurance company because remember back in the day, they used to be the bad guys. We don't want them to be the bad guys. We want them to keep providing service. We want to make sure that they cover people. But to do that, they've got to follow the rules. And one of the rules we want to make sure is absolutely in place is that they cover people with pre-existing conditions and make sure that they don't gouge them or jack up their premiums unexpectedly, and that they cover them fully and completely during the time that they have access to insurance. So these bills that Senator Erpenbach and I support, that all the Democratic legislators in Wisconsin support, are not the silver bullet. We've got a lot more work to do to reform healthcare to make sure everybody has access to affordable care and can afford really quality care in the state of Wisconsin. But it's a step in the right direction, and we hope you'll tell your mom, your dad, the people you work with, your sisters, your brothers, your cousins. We got to make sure these protections stay in place for folks. So thank you all so much for being here. Keep telling your stories. We're out here to do some of that today. Thank you.
Thank you, Representative Riemer. And you have to ask yourself, why wouldn't any of your colleagues vote for this? I mean, this is wildly popular. It does kind of show the disconnect between what the public actually wants and sometimes what happens in Madison. But we'll see. By pushing this issue, we really want to pass this bill if we can. But just to give you, we have some people talk about their own stories, but just to give you an idea, at this, when Assurant had a health insurance division, it sold it off, right? When they had one, they actually had an algorithm which launched a fraud investigation into people who were diagnosed with HIV. So why would you do that? In order to try to find grounds in the way they filled out their original application to kick them off coverage. In fact, they lost a huge judgment in Florida which demonstrated that, and of course the court case revealed that. So it's not just Assurant Health, and they don't do health insurance anymore, to be clear. It was a business model in general, and health insurance companies ought to want this business model. It's like we used to have child labor in this country, right? And the problem was that if only one company stopped using child labor, they'd be at a competitive disadvantage. So the only way to do it was to stand up and say it's a business practice that oughtn't to be legal and no one should be able to do it. And that's the same with discrimination based on pre-existing conditions. They don't charge them more to gouge them, they charge them more so they won't buy coverage, because they don't want any people who actually have a lot of medical conditions to have their insurance. So we're trying to change the whole system, and in fact, it's not just enough. I mean, this is a great step because we can protect ourselves from what's going on in Congress right now if the Erpenbach-Riemer package becomes law. But we need to move forward towards guaranteed health care for everyone and move way beyond the Affordable Care Act. That's what we need to be doing. Right. Yes. So I want to introduce Anita Abram, who's going to give us her health care story and why health care is so important. So Anita, thank you very much for joining us.
Thank you. Thank you. I need to read mine, and thank you so much for having me. My name's Anita Abraham, and my husband, Dan Schramm. We are activists and mental health care advocates, and both of us are disabled. We both are on Medicaid and Medicare, and without Medicaid, we would pay a bit over $1,000 a month for the two of us. This doesn't include our medication. Dan and I literally work for our insurance via a state program called MAPP, M-A-P-P. The program allows us to volunteer for nonprofit organizations in exchange for health insurance. It also puts a limit on our income. One year, we were $87 a month over our budget, and my husband had to cut back on his paid work hours as a peer support specialist for a mental wellness program, which he has worked for years. He has turned down raises for fears that we would lose our health insurance, earning just a few dollars over minimum wage. We also do not get Quest, and our food budget is very tight. It is out of the question for me to even think about getting myself a job because we would not be eligible for the wonderful programs that has given us the ability to stand before you today and to get health care with few co-pays. I have to use my time trying to make changes, volunteering, answering phones, making calls, stuffing envelopes. Activist means to be active. Many programs will be lost for mental health wellness programs and jobs, and the job that my husband has will be lost. I am grateful for organizations like Citizen Action and other progressive alliances that give people like myself and my husband a platform to speak.
Thank you very much, Anita. We want to bring up next Claudine Leno. She's going to say something about her health care. So thank you very much for joining us.
Thank you for having me. My name is Claudine Leno. My older son, when he was 19 years old, was diagnosed with a rare kidney disease. His father is a teacher and I'm a real estate agent. We have insurance through my teacher husband. But with the fears of what's going on in Washington, we're afraid that my now 22-year-old son with kidney disease will be uninsurable, which means that at some point, if his medications fail to keep his kidney disease under control, that he will need dialysis and a kidney transplant. This plan in Washington could be a death sentence for my 22-year-old son. Because of the medications he is on, he cannot hold down a regular 40-hour-a-week job. So he is on our insurance until he turns 26. One of the other threats with the health care program that they're talking about in Washington was to not allow children to remain on their parents' health care until age 26. So this means at any moment, my 22-year-old son would be uninsurable. And I'm terrified for his life at this point because he will not qualify for health care because of a mental illness diagnosis and his additional diagnosis of a rare kidney disease called minimal change disease. We are already, even with fairly decent insurance, paying off the medical bills that we received when he spent a week in the intensive care unit. So without any health insurance, I can't imagine what that would do to our family and to my son just starting out in life as a 22-year-old. Thank you.
Thank you very much, Claudine. And it points to the fact that, I mean, the folks who want to throw 23 million people off healthcare are suggesting that somehow people who need us as a democracy to create the conditions where they can get health coverage have done something wrong. And it's absurd, of course. They've not done anything wrong. Anyone can have a major health condition any time in their lives, and we believe that they should be able to get full medical care, that healthcare is a human right, not something about whether or not you have to be profitable or not for a large corporation. So let me bring up Caitlin Drew. Hi, Caitlin. She's already right here.
Okay. Well, when I was 28, I started having partial seizures. I was uninsured at that point for a couple of years and still went uninsured. I had no idea what was happening to me. And a couple years later, at 31, I had my first grand mal seizure. Luckily, I wasn't alone. My now fiance was with me. I had to go to the emergency room, which I'm now still paying off. the next year I got on the ACA, which I had been previously just terrified that I couldn't afford any insurance at all. But I qualified for subsidies and I got on a really great insurance plan. I was able to start getting the treatment I really needed that made it easier for me to function, made me understand what was happening to me, and just made me get better as a whole. And now I'm on my work plan, which is comparable, just a little bit more expensive. I thought maybe because I'm low income, I would qualify for those subsidies again. And I tried to look up the ACA plans again, and I didn't qualify for those subsidies anymore, and it would have been even more expensive than what I'm paying right now. And I found out that's because the state didn't expand Medicaid, so I'm still paying more than what I previously paid, but luckily still insured. I am afraid for the future, if I were ever to change jobs or to lose my current job, that I would lose my insurance and be uninsured again, not be able to afford any medications that I need to keep me seizure-free, which is ultimately what I need to, again, function, to be able to do basic tasks like drive, be able to carry a cup of hot tea without worrying about spilling it on myself and burning myself, and just be able to do basic tasks without having to worry that I'll injure myself every day.
That was a really important story, Caitlin, because not only, I mean, you can see just the situation that we put people in and how much worse that would be under these bills. That literally an American shouldn't have to fear that they have to hold on to this one job as their only way to get life-saving health coverage. It just shouldn't be the case. It's not right. And it would get tremendously worse because conservatives promised better health care, easier to use, lower deductibles, lower premiums, but it was a bait and switch. And so the House bill was the opposite. But we need to keep the pressure on the Senate. And so we're going to help Senator Johnson in his deliberations by delivering the Riemer-Erpenbach package over to Senator Johnson's office so he can show the negotiators in the U.S. Senate, hopefully, what they should be doing in the U.S. Senate bill. But in the meantime, if there's a risk of a flood, a hurricane, which is where we're talking about life and death situation, we take precautions. So the state law should just be changed. Then people are protected. That's not everything we do in healthcare, but it'd be a huge step. And we should do that now because we have a whole House of Congress that has passed a bill that would restore pre-existing condition discrimination, undermine essential health benefits, which means, bizarrely, that the premium might be lower because it doesn't cover very much, which isn't going to be very helpful, is it? I mean, in fact, that's life-threatening. And restore things like lifetime and annual limits. So the whole situation is bizarre given how unpopular those things are, but it's partly what Daniel also referred to, that is they want to take the money for healthcare, $1 trillion, and plow most of it into tax breaks for the wealthiest Americans, which we don't really need another tax break for the wealthiest Americans, the people who've been doing the most well. What we need is to stop this war over the Affordable Care Act, where Donald Trump is threatening the law. It was sabotage, threatening to cut off payments that would drive insurance companies out of the market altogether, and instead move forward and build on the Affordable Care Act. It was never meant to be the last step in healthcare. The only reason it seems that way is because of the almost seemingly endless attempts to sabotage it, undermine it, or repeal it from conservatives. And so we would like to move beyond this debate and then start to see conservative healthcare policy that actually helps solve the problems people have in the 21st century, rather than simply try to undermine what we're trying to do together to guarantee a fundamental human right. So I don't know if Daniel, if you had anything else you want to say, or
just it's a great honor to be here with all of you, to hear your stories. Reminds me and hopefully anyone and everyone who will listen and hear what we've had to say today, why it's absolutely vital that in the United States of America, the greatest country on earth, in the state of Wisconsin, the greatest state in the USA, we have protections for people who get sick or dealing with an illness. We make sure that insurance companies can't say, oh, you've hit your lifetime limit, or oh, you've hit your annual limit, we're not going to pay for that treatment. That we make sure that really basic preventive health services are covered, and that essential health benefits that help women who are going to have a kid, that help people who go to the emergency room, stay a part of the law. I'm hopeful someday in the state of Wisconsin, someday in the United States of America, with all of us working together, we'll get to a place where everybody has access to affordable, quality health insurance. And seeing you all here today and knowing how many people are behind this effort, it really has encouraged me that we're moving in the right direction. So thank you all.
Thank you.
Thank you guys.
And let me just say this about everyone who came. This is what we need to be doing. They would have repealed the Affordable Care Act and replaced it with something as bad as the House bill in early February if it wasn't for the incredible Democratic outpouring. And the Senate will do the same unless we keep it up. So we need to keep being good citizens and putting a bright light on what's going on. This is democracy that took so long, that was so hard for them to pass, given the composition of the U.S. House of Representatives, shows that democracy can work, but we need to keep doing this. We need to keep it up until the danger is past, and we also need to put pressure on state leaders to support provisions and bills like the Riemer bill, which is the state taking precautions against the danger that's currently being posed by our own federal government. So with that, thank you very much, everyone.
Great. Thank you all.